Hey, also, I had a shoulder dislocation come in the ER the other day and gave me an idea for a podcast using ultrasound to diagnose shoulder dislocations as well as to affirm that they're relocated after you've done them. So here goes. Let me know how you think of it or how you like it. So there's been a number of studies out that show that the diagnostic accuracy is really up there. Basically pretty much 100% sensitivity and specificity. And I find it much easier to diagnose dislocations with ultrasound, especially posterior dislocations. Ultrasound is just much easier, period. So some of the anatomy you need to know, of course, be able to pick up scapula, clavicle, the glenoid, coracoid process, and the acromion. And here's some relevant anatomy. Of course, we all know what the scapula is. Let me pause this and change the color of the pen. So, of course, we know what the scapula is. And of course, the coracoid process here, the acromion here, and of course, humerus over here. I'm sure we all know that. Head of the humerus. So probe and position, get rid of that. Yep. Is important. You can use either the curvilinear, which is what I prefer, especially on the larger individuals, or you can use the high-frequency linear as well, but I find that the curvilinear is a little bit easier. And here is the position and the probe position that you want the patient in. Sorry about that, I had to sneeze. It always interrupts me. So this is the position you want the patient as well as the probe position. You can see it's on the back part of the shoulder. Yeah, also this is how you ultrasound the shoulder. You find the scapular spine, which is right here. And you can see on the ultrasound the scapular spine. And then you just move your probe down to just below the scapular spine and then move it a little bit laterally. Move your arm in and out. And you can see the supraspinous tendon moving back and forth. You can see the scapular spine. Okay, stop moving your arm. And you can see the glenoid and where the humerus, the head of the humerus goes into the glenoid. And obviously that is not out of place and it's right where it's supposed to be. Move your arm in and out again. You can see the supraspinous ligament moving again, as well as the head of the humerus. Okay, stop. You can see the glenoid fossa and where the scapular spine is up here. And again, just move it down and lateral. And there you are. So it's very easy to get, very easy to diagnose shoulder dislocations or to make sure you have it back in place. And here's an ultrasound of normal anatomy. This is the scapular spine here. And of course, this is the head of the humerus where it's supposed to be. And this is enlarged a little bit, but you can see how it's supposed to look. Of course, this is bone shadow down here. This is medial. This is lateral. And this is really important. This is posterior, and this is anterior. So if you have an anterior dislocation, this humerus is going to be down in this area because you're looking at the probe from the back. Remember, so you're going to see the posterior first as it goes through the back to the front. And here is another normal ultrasound, a little bit, or not quite so enlarged. And you can see the scapular spine here. This is the humeral head. And again, this is posterior heading towards anterior. And this is medial, and this is lateral. And it's important because you think you're on the back, and just by looking at this, you can tell that this is the left shoulder. You can see this mark here, and that should correlate with how it is on the back. So your probe is on the back like this. You know that this is lateral, so it has to be the edge of the shoulder, so it has to be your left shoulder. And it's important to be able to understand the dimensions of the ultrasound and how it works. And here, take a minute to look at it. This is posterior. This is anterior. And this is lateral. And this is medial. And this is a scapular spine here. This is the head of the humerus way down here. It's obviously difficult to see. And it's an anterior dislocation because you're going anterior down here. Remember, through the back, posterior, and on to anterior. So what this is here is blood, fluid. Sorry about that. So this is blood, fluid in here. And of course, you have that anterior dislocation. And here's another one that you can see again. Posterior's up here, anterior's down here, and you're looking through the back towards the front of the body. And this is the humerus down here, and it looks like your scapular spine is up here. So you can see there's quite a bit of space here. And again, it'd be an anterior dislocation because here's your humeral head. And it's easier to see these on real time than still pictures. And here is one you can see here. Again, this is posterior. Here. This is anterior. So this is humeral head here. This is your scapular spine on into your glenoid. And you can see that the humerus is posterior to where it should be. It should be sitting, right about here. So this is posterior, so this is going to be a posterior dislocation. Looks like I drew on that one already. That's one we just did. Oops, sorry about that. So here's another picture. You can see the scapular spine here, the head of the humerus here. Again, this is posterior. This is anterior. This is lateral, and this is medial. So this would be another posterior dislocation. And you can tell that this is right shoulder because your mark is here. As long as your probe is directed the right way, which I'm assuming it is, then this has to be towards the left, and this is to the right or lateral. And here is another normal shoulder. You can see the scapular spine come here. This is the head of the humerus there. Again, posterior, lateral, anterior, and this is medial, and this is lateral. And another picture. This is your scapular spine. Looks like the head of the humerus is down here. This is a pretty crappy picture. But again, you can tell that it's an anterior dislocation because that's posterior, that's anterior, and medial, lateral. So this is obviously a nice dislocation there. And last one, you can see scapular spine here, head of the humerus down here. And again, this is an anterior dislocation because this is anterior, this is posterior. And this is medial, this is lateral. So with your mark here, you know that this would be a right shoulder. Now, this one here, by the way, you can see that a needle right here is being placed into the joint space. And what they're doing is they're putting local anesthetic in there before reducing. What I like to do is withdraw any blood, fluid, etc. that's in here, and then inject 20 to 30 cc's. And since the pain's pretty much gone after you reduce it, I'll use a short-acting and just use 1% Lido for it. Now you can also do a interscaling block and get really good relaxation. If you have a really difficult one, then you may choose to do a interscaling block and just be done with it. So this concludes the short and sweet podcast on using an ultrasound with shoulder dislocations. I still tend to get x-rays just because I want to document if there's also a fracture along with it, because a certain percentage of these will have various fractures associated with them, and I'm not good enough to really pick out these little tiny chips and so forth with the ultrasound. The x-ray tends to pick it up pretty well. So I hope you enjoyed this. Try out my YouTube channel, and have a great day.